be the best way, because I'm having, even if I shift my body weight back, I'm having to pull here. If you're doing it for a sustained period, it's hard, or if you're maybe not as strong to get that, and then you're having to pin them down here. A couple things with that. One, make sure you're not too distal. Make sure you get right there close to the joint, right? If you're distal, you may have the problem of pulling the elbow down this way. Some people wondering about the arm kind of falling out here. If you get really proximal, if anything, your traction is not, you're not going to have the trouble with the arm falling back and forth. That's one thing. Another would be that you can do this different ways. So some people were talking about, they were kind of messing with doing it different directions. When you're in the clinic, there's lots of different ways you can do it. For example, excuse me, someone could block down, you could have, if you have a partner, someone could block down this side, right? And then you could come in there. So we can try it actually. Here, I'll show you. So does someone mind? You want to come in? Okay, so just kind of block down right there. So, yeah, now you're on video. Good, good. Okay, so then you can get this hand in here, right? Same area, but then this hand can come around kind of over to that side, and you can do your distraction from here. Do you feel that? So if I'm getting good body mechanics and shifting back. Okay? So that's one way, having someone block it down. Another way is if you have some sort of belt that can lock it down, you may have to raise it up on something and then lock it down with the belt. Or just things to keep in mind as you're doing this. This is the reason I'm telling you different ways. It's more important for this class for you guys to understand conceptually what's going on, right? You're causing that distraction there. There's tons of different ways to cause that distraction. One way, which I actually haven't done, but it's a cool way, I've seen it in the book, and it wouldn't be that complicated to do, is you can block it down yourself with your hands, take a belt, get it on the proximal part, wrap it around here, around your waist, right? I don't know what's going on anymore. That's okay. Wrap it around here, block down here, and then just shift back. Now your body weight's doing that distraction. So if someone is having more difficulty, there's belts in clinics. I couldn't open up that one to try that one out, open up the door. So, but you could always try that one to get that distraction. Remember, listen to your patients. That's the big thing. Are they feeling it? You guys know what it feels like now. So listen to your patients. Are they feeling it? Is it pain relieving? You know, what kind of things are they feeling? How long do you hold it? It may depend on what they're feeling. Does it start to increase their symptoms and you may let off, or if it's feeling good, you may hold longer. Things like that. This is kind of a general catch-all stretch distraction. Okay, so do you guys want to go ahead?
You know when you hold it,
yeah.
The hand placement, are you supposed to just hold the ulna or the whole hand?
Okay, so that's a good question. Are you supposed to just hold the ulna or the whole hand? Obviously, if you could just hold the ulna, it'd be great, right? You could just distract that. I don't, my personal opinion, think that's really realistic. That's why, if you think about using a belt, you're not holding just the ulna, right? But they still, some of the people, the Kelton-born and the people that are big into these mobilizations, they'll use a belt. So that in and of itself shows that it's not always just the ulna. Or if you're coming in here with two hands like this. But if you look in your picture and if you think about it, you don't want your force to be trying to be equal on both sides. If you're doing this, you're trying to wrap this hand over here and think about pulling on the ulna. It's your best shot at getting that ulna out and distracting. That's the way I would describe it. That's why you're coming in from this side versus this side. Whether you're moving the radius or not, that's okay. Maybe you're getting some sort of distraction there a little bit. The radius isn't in the best position for distraction, so I doubt it's getting as much, but you're still, the goal is to get the ulna. It's okay if you're wrapping over towards the radius. Does that answer the question? Okay. The other thing is just patient, listen to your patients. If all of a sudden there's nerves, blood vessels, if this isn't comfortable, or depending on what you're doing this for, but if you're getting all this nerve tingling, maybe back off a little bit. You know, you don't want their whole arm to go to sleep. And once again, I say that with the fact that depending on what you're doing it for, some post-op surgeries you may want to push harder or some less. You know, it kind of varies patient to patient, but listen to your patients. Okay, so I'm going to let you guys try that just real quick again.